but they don't necessarily like teach you how to be a dentist.
You feel like, oh, I'm a failure.
It feels like the world is actually ending.
They're not just a number or quota that you have, they're real people. Welcome to the Learning Edition. If this is your first time listening in, we're grateful to have you. Maybe you're a dental student on your way to class right now and you're heading to SimLab getting ready to prep some teeth. Or maybe you're a new grad on the way to work, getting ready for a week of seeing patients, and you could be excited or feeling a little bit stressed out. Whoever you are, this podcast is for you. So let me tell you about us. We're 4 dentists, all early in our careers, and not long ago we were sitting exactly where you are as a student. And for some of us, we're right there with you as a new grad. And we're from 4 different corners of the world. I'm Nathan from Australia. We've got Brendan's from the US, Reyna and Megan from the UK, and we're all trained differently. But that's kind of the whole point. Because the dentistry that we're about to talk about is universal. Even though it's learned differently across the globe, we think that the problems, the challenges, and the journey, that's all experienced the same way everywhere. And the biggest problem is that no one talks about this journey. You look on social media and everyone shares the successes, the wins, but no one talks about the honest, messy process of getting through it. The Learning Edition is about breaking through that. It's about reminding you that you're not alone in this, no matter who you are, no matter what stage you're at. And we might look like a bunch of random people brought together, but that's kind of the whole point. 4 different walks of dentistry, all facing the same things. And I think the conversations that are going to come out of this are going to be powerful. We're excited to have you. So let's start with a little bit of introduction, guys. So maybe we can share a bit of who we are, where we're from, and maybe a fun fact. And since I'm yapping already, I can start. I'm Nathan. I'm from Australia. I'm a new grad dentist. And a fun fact about me is that when I was in 3rd year dental school, I went to do a dental outreach in Nepal. And as a side quest, my friends and I, we went to climb Mount Everest Base Camp.
My name is Brandon Labe. I grew up in California, but moved all over the U.S. When I was up, my fun fact would be that I was an aspiring professional hockey player, trying to get out and go to the NHL. Didn't quite work out. Had a little too many injuries, and so I had to fall back on something else. And I got a gig as a dental assistant, where I enjoyed dentistry and decided that was where I wanted to go. So I went out to University of Pennsylvania in Philadelphia. And now I currently live in Lake of the Ozarks, Missouri, just like the TV show The Ozarks, if you guys have seen that before. Great show on Netflix.
Cool.
And, so yeah, that's my place.
My name's Reyna. I'm from the UK, or England more specifically. I'm a first generation dentist in my family. I went to a state comprehensive school. My mom's a single parent, so after graduating last year, just super happy to be on this journey in dentistry. So one fun fact about me is that I'm not a professional baker, but I would say I'm a bit of a pro at baking. So when I was in school, my side hustle was making cakes for like baby showers, birthdays, engagement parties. So it's something that I don't do as much now working full time. But yeah, it's definitely kind of my side passion outside of dentistry. So my whole plan was to kind of create, lots of sugar in people's diets. So they need lots of fillings and then they come to me and get it fixed. So that's a pretty good plan. It's worked out so far. But yeah,
Crazy.
so I know. I didn't plan it out, obviously, because I think I decided I wanted to do dentistry after I started baking, but it worked out well. Maybe it was all in my subconscious, but yeah, so I'd like to also pass on to Megan, who's also from the UK.
Hi everyone, I'm Megan. I graduated in 2023 and I'm currently working in Glasgow in Scotland. Everyone's journey into dentistry is slightly different. And going back to the beginning of my story, I'm originally from Scotland and was very set on going to one of the Scottish universities. At the time, I unfortunately did end up not getting into one in Scotland. And at the time, it feels literally like the end of the world. You have your heart set on something and it feels like the world's falling apart from where you are. I'm so glad that I did end up getting into one of the English universities. And if I didn't, I wouldn't have met my husband, who is also a dentist. And my fun fact is that we've recently got married in a Scottish castle. And I think it's really important, whether you're applying to dental school, you're in dental school, even applying for your first job, just have the faith that you will end up where you're meant to be and you'll end up exactly in the right place. And if you really want to be somewhere, whether that's going down a route of specialising, becoming a practice owner, even just getting into dental school, just remember if you've got your heart really set on something, you will get to where you want to be. Even if that's the scenic route, if it takes you longer than most people, if it looks different to one of your friends or someone next to you, just trust the process and you will get to exactly where you want to be.
I really like what you said, Megan, and it was really sort of touched on the sentiment that I think all of us were sort of having that mindset about trusting that process, that no matter where you are and sort of as long as you have that vision and you sort of keep walking towards that, you eventually get to where you want to go. And I love that. I think that was really well said. Yeah.
I think the path to dentistry, there are so many obstacles. It's not just like you go to university and you get a job. You know, we had so many kind of hurdles along the way, from the application process, from exams we had to sit, interviews, and, you know, it's that rejection that we don't experience until we maybe apply to dental school the first time or start the journey, because, you know, we were all probably very ambitious, you know, young teenagers, young adolescents, and we kind of just went through school, you know, getting A's and getting top grades. But it's just like Megan said, it's that first time we're experiencing rejection, and that transition from being a student in like high school to then going to university. It's so different, isn't it? Yeah.
Yeah, you definitely go from being kind of, when people apply to dentistry, you might be the top in your year at school. You're one of the ones that does well in exams. But when you go on to dental school, everyone who's been selected is also really good at their school. So you go from being
Exactly.
really good to a different kind of level playing ground, and it can be easy to kind of have the imposter syndrome where you don't feel good enough, or you might not. The transition into the first year of dental school can be difficult. You might sort of be used to doing really well, and then you find you're not doing as well as you want to. I
Yeah,
know
and
in
then you're
my
just like
first,
average. Yeah, you're like the most average person because
exactly,
everybody is getting top grades.
yeah, I remember my first set of exams in first year. I didn't do as well as I'd wanted to, and it was actually a good sort of way of kick-starting that sort of drive. Like, actually, I do want to be better at this. And it really made me determined to put the work in, and then ended up managing to get such a higher mark next time. But it's a bit of a shock at first. How did you find the transition, Brandon? Because in America, it's slightly different. So you go from college and then into university.
Yep. So for me, it was I think I had like a different transition where honestly I struggled a lot in college. I actually was not necessarily like the naturally smart or like, straight A student per se that most dental, most dentists are. And I think that actually kind of helped me a little bit because I have failed, I failed exams in college. So I kind of had that understanding of like, oh, it happens. And not that it's good, but it made it a little bit easier to deal with like, when I experienced failure in dental school and everything. But we usually do, 4 years of college. From there, some people take gap years. I don't know if that's common for you guys, but for us, it's pretty common to take 1 or 2 gap years. I took 3 gap years actually, but I did mine between high school and college actually. So I started college at 22 years old and whatnot. But from there, after you graduate dental school, we also do residency sometimes. It's not something that is required in the US except for like 2 states, but a lot of people still do it because just dental school training today, is just not quite enough a lot of the times. And so to get more reps, to expand your skill set, for me, I did a 1 year residency and it was so I could learn a lot of surgery. So I do a lot of, implants, extractions, I do endo, full mouth rehab, all that kind of stuff. And that's kind of where residency is like that foundation of it. Do you guys do residency or have something similar?
Not a specifically residency structured program like right after you graduate.
Hmm.
It's
Uh-huh.
pretty much the moment you get the degree in Australia, you are a dentist already. You can sort of
Yeah.
choose to take on the extra CPD courses to increase your development, but really you're just like, I'm in a deep end now. Wait, can I ask some? So college is like, because we don't really have a college concept in Australia. We just sort of have like senior school. It's sort of like the teenage
Yeah.
years before we go into university. Is that one of the
Yep.
similar things?
So it's after that. It's like after high school, we graduate high school at 18, and then you usually go to college for 4 years, and then you go to dental school for 4 more years. So, so I'm probably a little bit older than you guys. I'm 33, and
That's
I've been out
so
for what,
crazy.
3 years now. So it's definitely a long journey here, and it's a little bit. I don't know how necessary it is. That's something that a lot of people criticize, like the American way American education is, because it's just I studied biology, right? Like I know way too much about how plants develop and grow that is completely useless, right? Like, and so it's just one of those things where, it'd be a lot more efficient if you just go straight into dental school if that's what you want to do.
That's crazy. I never knew that. I never knew that you had to do the high school part, and then you have to do another 4 years of college before you then go into dental school. Because in Australia, it's
Yeah.
like most of us, it's like our high school slash we call it senior school here. We do that. We're 18, and then we go straight into university. So a lot of people can get into dentistry straight away. I for myself sort of relate to what was said before. I didn't get into to what Megan said before. I didn't actually get into dentistry straight away because my score was not high enough, and
You're a
which was
dentist
okay
now,
because
Nathan. It's okay. You made it
yeah,
now. We're here.
that's why we
We're
all
all
got the same
Yeah.
doctors.
piece of paper. We all got the same piece of paper in the end,
Yeah.
but it was okay because honestly, when I was in and maybe someone else can relate to this, when I was in high school, I still when I was in my final year, I had no idea what I wanted to do. I had no idea. Dentistry was, to be very honest, was like only something that I really sort of took on or really learn and really got more interested in after a couple years after high school. And I think in high school, I wasn't a straight A student as yeah, I was not a straight. I was definitely not top of my class. I didn't get the high enough results to get into dentistry, and that's probably yeah when things sort of kicked into gear for me afterwards. And it took me a couple of years to then start realizing that dentistry was something that I wanted to go into. I guess the question I wanted to ask was, why did you guys sort of choose dentistry?
Classic interview question, Nathan. I think for myself, I think I mentioned in my introduction, there's no kind of dentists or doctors or any healthcare workers in my family. So dentistry was something that has never been done. And I didn't know anybody who were a dentist or, when you have to apply for dental school, you need to get, your work experiences. It was very difficult to even get a mentor to kind of help through that process. I was always interested in science subjects, like Brandon studied biology. Biology was my favorite subject in school, and I knew I wanted like a people-facing role where I could actually not just be at a desk all day, but actually interact with people, help people. And naturally, I was just drawn to dentistry, mainly because of the work-life balance. And I think it's a good balance between helping people, it's very fulfilling and it's not as draining and, sacrificial as medicine is, because I was just not built for kind of night shifts or kind of long days or even having that kind of responsibility of someone's life is in your hands. I'm okay. I'll just deal with the teeth. Thank you. And I'll move on. Having said that, I am going to be doing a year of max fax where I have to do night shifts in September. So yeah, that's kind of backtracking on what I just said. But yeah, I would say, I think for all of us, we want to help people. We wanted to be in a profession where it is, something that's more practical than just kind of having an office job. No hate against people who have office jobs, but I think dentistry, just with how creative it is definitely just suited my personality. What about you guys?
I kind of looked up to my dentist when I was younger because she was really nice and really gentle. And then I was like, I actually want to be like her. But interestingly, when it came to getting work experience, so normally in the UK, you need ideally like a couple of weeks as you're sending your application. But my own dentist refused to let me do work experience, which was a bit crazy. And they said, oh, come back in 6th year, which is too late because your application's already gone. So I actually ended up going to Tanzania to get some work experience, which was really interesting because it showed me sort of the most extreme dentistry, like people that lived in tribes and they had to travel for hours and they had massive tumors. And it made me see the extremes of dentistry and how important in the UK that access and prevention. And then that definitely sort of fueled me through my exams, sort of made me very set on this is what I want to do and determined to get there.
Oh, that's so inspiring. So how long were you there for?
So it was for 2 weeks when I was 16. So it was my first time traveling on my own. So it was definitely quite daunting and a bit of a culture shock when you arrive into Africa and there's people sort of crossing the motorways and yeah, huge culture shock, but I'm so glad I did it because it was just amazing. And I think even today, it still keeps that drive, and it does make you realize how important even taking people out of pain is. I think for me, that and giving people smiles back is just so rewarding.
Amazing.
How
Well,
about
I think,
yourself,
yeah,
Brandon?
having, yeah. Oh no, Brendan, yeah, you can go.
Sorry.
Yeah, yeah. I mean, for me, it was just like the impact. I know it sounds cheesy, but it's like the impact you can make on people's lives. You know, after I think I mentioned I worked as a dental assistant for the dentist I grew up going to, but I didn't do it with the thoughts of like, oh, I'm going to go be a dentist. It was more just like, I don't really know what to do with my life right now because I that was like after I finished playing hockey and I had too many injuries, so I knew it wasn't going to happen. And I was like, where do I go from here? And getting to see, you take this thing that like everybody hates going to the dentist, right? Nobody is like, oh, I cannot wait to get like my tooth pulled out, and taking something that is really scary and making it not as bad, that feeling you get from helping those people just really made an impression on me. Or it's like, or when you change somebody's like smile and like giving their confidence back, like getting to see that impact was what drove me to be like, this is what I want to do for my life.
Yeah, you guys have some powerful stories. You guys are like gonna make an impact, and I definitely sort of vibe it. I realized that when I started this topic, I didn't even share about why I decided to do this industry. I just sort of skipped over myself. Kind of alluded to it. I had
So
not
what
really.
age were you? What age were you, Nathan, when you decided, maybe I could be a dentist? Because you said that you'd realized that, you didn't know what you wanted to do when you were in
Yeah.
like high school.
And it's a great question, and honestly, whenever I hear people's story about like why they choose dentistry, I'm always so envious because I'm like, wow, they got like such a powerful story. Like Megan, you're going to Tanzania, you're like seeing this crazy work. Like Brendan, you just like had a seeing the impact that you want to sort of do and drive. And Reyna, honestly, you were born for to be a dentist. Like you want to bake and so you already got a creative mind, you know. Like for me, yeah, the manual dexterity. But for me, it was
Yeah.
always like I have no idea what I'm gonna do. High school wise, I was just like try to get the highest result I can, and then we'll see what we can do. And I think I actually did. So what happened was after high school, I actually went back to Singapore, which was where I had citizenship, and I served 2 years in the army as a combat medic there. And that was when I sort of started realizing that I'm a people person and I want to help people. And like you said, Reyna, no hate to office jobs, but I couldn't see myself being working in that sort of role. I think seeing the impact that you can make eventually was like, okay, that's something I would like to do. Also, I just heard that the work-life balance of a dentist is better
Hmm.
compared to other health jobs.
Compared to a
Yeah,
combat medic as well.
compared
Better
to
Yeah.
hours.
yeah, it's a bit
I
Less
think
safer.
that's
stressful.
really it's really interesting and really helpful that you share that, because I think it is very split when people are applying. Some people have no idea, and as you say, you're just trying to get through, do the best you can, and it takes time to work that out. And I think a lot of people can relate to that. And even some people are, when they're applying, they don't know whether to do medicine, to do dentistry. And I think it's good to know that everyone has such different journeys. And I felt really lucky that from the age of 14, I was really determined, like, this is what I want to do. But I can see how it's so much harder if you don't have that, you don't know. Even like choosing subjects, some people don't have the sciences at the beginning and then they end up having to do like a different degree. Everyone sort of ends up in the right place in the end.
So I think, yeah, I think the journey just works out the way it's meant to be in the end. But what kind of transferable skills did being a combat medic kind of lead you to doing dentistry? Like, what skills could you have used when you're applying? Because it's kind of such an extreme difference, being in surgery and practice and being a combat medic. Like, I've never heard that before, Nathan. You're like the first person I've met. So
Yeah,
yeah, you
yeah,
have to
fair
tell you
enough.
have to tell us more. You have to tell us more.
Yeah, shout out to my boys in the combat medic section, but honestly, it just okay, transferable skills. I can't say we're too fine dexterity as a combat medic. Like
Hmm.
we, you sort of once you get into that sort of combat mindset, it's very just sort of blunt and vigorous. Like in dentistry, we're like finesse a little bit. We're like being
Hmm.
careful. Medic, we're like strap this tourniquet on. Like just let's tie you on. It's a bit vigorous. But I think the main thing that really got me was just like being exposed to the health side of it, like being like looking like there's a person in front of you and seeing that there's a person that you have to take care of, and like health is so important. And I think those principles rather than the actual hand skills themselves was something that I took alongside. And was the main thing that I got from that. And yeah.
How did everyone find like it's useful, Reyna, having the baking to get your sort of hand skills and manual dexterity, but how did everyone find like that first like simulation clinic, first time picking up a drill? You've never done any hands-on skills
No, I
compared
have
to
to
like doing
say,
normal exams.
even though, baking maybe my manual dexterity would be better, I remember the first cram prep I ever did, my tutor came over and he said, "What is that?" Like, I don't even know what tooth I'm looking at. I don't even know what you have done to this tooth, but you butchered it. Brandon, having been out of dance school for a little bit longer, do you remember your first simulation sessions? Like, how did they go?
I remember it absolutely. I especially, so like for background, I had zero experience with like any sort of manual dexterity. Like I actually almost failed my art class in high school because of my hand skills were so bad. And so I knew that was probably going to be like one of the biggest challenges for me. And I did, I was like kind of known in my school as like always being in the sim lab practicing, and I still failed my first practical. I remember it because of it was doing a class 2 composite restoration, and it just is one of those things where it feels defeating. I got assigned a tutor and everything, but the good news is it really is just a skill that you can learn, right? Like I just put the time in, and it took me a little longer than probably most people did, but it's something that probably is more of a strength for me now. Now I post my work on my Instagram, like I'm pretty confident with my crown preps and whatnot, and so the good news is it's something that's learnable. But oof, it was definitely probably the harder part for me during dental school. What about you
That's so
guys?
reassuring to hear, Brendan. You struggled, and then to
Yeah,
see where you are now, the work that you're doing
yeah,
now, it's like, we got hope. We got hope.
yeah.
Megan, question. I think you generally opened a can worm of trauma for me. Like,
Yeah.
rough. SimLab was rough. Genuinely, I think I was a guy. I'll go to SimLab and I'll always be the last one to leave. I'm just trying to catch up to everyone else. And my tutors were just like, you gotta get out, bro. Like, you gotta just try again next time. And SimLab was, yeah, I just remember it not having the hand skills. Like, people will always just be able to pick things up way quicker than me. I'll be always asking the person next door, why is it not turning out like what the demonstrator is showing? But I completely agree that is actually a skill, as Brendan said, because I think after you practice and you get more of the reps in, which was what I found, it's like you slowly get better and better. And the class 1 or the class 2 wrestlers, I was struggling in SimLab, I was nearly failing in class. It's like once you get into clinic, you start seeing patients. It's like you're just doing it normally. You're freaking out about other stuff now, but you still don't remember that you were struggling right then with the same thing.
The crown prep exam in like whichever year it was, and it's so stressful. It's literally like per millimeter. If your margin isn't 0.1 difference, it's like so precise, and it's something that I got through that one, but it was definitely not looking like a tooth prep. And it's something just now I'm doing the Right Global Restorative Fellowship, and I've recently done the crown prep one, and it's so helpful because they literally make you like prep almost every tooth, and it just shows you repetition is key. Like if you literally just keep on practicing, you will get so much better. And it really ties in with like time management. Because I remember previously, even cutting into proximal contacts, I would be like tickling the tooth, like, oh, I don't want to touch
Hmm.
the adjacent one. And it takes you ages. Whereas, particularly with the diplomas, when you've literally just, they even make you do it in like 5 minutes. They're like, go, you just need to do it. And it just
Yeah,
forces you to just cut the teeth, and you definitely notice over time with the practice, your hand skills get so much better, a bit like riding a bike. You just get used to the movements. But it definitely at dental school is a struggle, especially when you've never done anything like it. I tried to do kind of woodwork in my last year of school to kind of put it on my interview that I had some kind of drilling skills, but it's definitely not until you're actually in there and practicing that you sort of notice that and get better.
that's so true. And I feel like in dental school, the most illegal thing that you could have done is touched your on the adjacent tooth. Like, it's like the world's worst crime. Like you're going to dental jail for that. But like you said, Megan, you've got to
Yeah.
put in like they say you've got to put in your 1,000 hours before you become, well skilled at something. And, repetition is key. Like at the beginning, we've never picked up a handpiece. We don't know, how powerful these bars are, the drills, and, we all are bad. One thing they don't teach you in dental school is that you're going to be bad at the beginning. You're going to be so bad. And, from the second year to the third year to the fourth year, you'll see very incrementally how much better you're getting. But it's not until you start working and so you stop worrying, oh, I have a class 2 filling tomorrow. In your third year of dental school, you would have been worrying all night, like, oh gosh, what am I gonna get out? Like the instruments, like gotta write out my notes before, and you just feel so anxious about it. But now after working, even, for myself, I think I've been working for about 10, 11 months. I don't think about what I've got in the next day because you just grow in confidence and you grow as a person so much in dental school. So yeah, repetition is key.
I think as well at the time
Absolutely.
it feels so like you don't realize how difficult it actually is. Like when you have, say, you lived with flatmates that are doing something completely different, like for example in the UK, if they were doing like psychology or something and they get like so many more holidays and they've got like a reading week here and there, whereas you're in the simulation lab and it feels like the worst thing if you cut the other tooth. But then when you actually take a step back and realize how difficult, because it's like upside down, back to front, it's wet, you've got someone's tongue moving around per millimeter, like with even with an endo, getting right to the end. It's just it's so niche, and sometimes when you're in that process, you feel like, oh, I'm a failure. I've not got my crown prep looking perfect. But then sometimes you do actually need to give yourself a pat on the back and realize how difficult it actually is. And I think a lot of people don't talk about that. You might see like the perfect crown prep or the perfect something, but they sometimes they don't talk about the person that had like limited opening. They're anxious even if you even get the anesthetic out. It's just, I think we definitely need to give ourselves more credit for how difficult it actually is. And I think as a student, it's not until you start talking to friends who do something completely different where you actually realize we are actually doing a really hard job.
I think it's also funny how it's like they make it seem like it's the end of the world if you touch the adjacent tooth, but in real life, what do? You just polish it, make it smooth, and I haven't had any patients die yet from me touching their adjacent tooth, right? Like they all are still chewing perfectly fine, right? It's funny how like the things that dental school focuses on, especially in those sim lab clinics, right? It's like you got to have like only like a millimeter and a half like width or something on your box, or and it's like when have I've never prepped the filling and thought, okay, I need to make a millimeter and a half box here, and then I'm gonna smooth out all these like line angles and all that stuff that like just you realize like doesn't actually matter.
Yeah, no, totally relate to everything that's been said. And, I hit the adjacent tooth many times, and that's why I always had a spare tooth to replace. So I always do a sneaky, and maybe I'm
Smart,
illegal for
smart.
doing this.
They'll
Maybe my
never know.
supervisor, yeah, maybe they're gonna take away my degree now. But I used to, yeah,
Yeah.
just like unscrew the next door and just replace a new one and call it a day. But yeah, I mean, I guess what we've all shared is like, I feel this is something that I've realized when I was in dental school is that the hardest part is not building the hand skills, because like Brandon said, it's a skill, and then the more you do it, you're just eventually going to get it. You eventually will. You just have to trust that process. I feel like the hardest problem is just generally getting the right mindset to get you through that. And I feel like we touch on such powerful points already, like how you do failure. The comparison trap is probably one of the biggest ones that I face, being surrounded by so many sort of skilled people. And I think Megan, you touched about that earlier, where when we get into dental school, we almost like get humbled straight away. Because when we get into dental school, we're like, oh, we're like doing pretty well to get here, and then now we're on the level playing field. That hurt my ego a little bit because I realized that I'm really not all that. So, what are some of the, I guess, um, struggles that you guys face aside from just the hand skills, and what sort of advice or things that you learned to help you get through that?
Such a good question. I'd have to say the classic imposter syndrome, only because, I had no idea what to expect in dental school. And even though, I'd got pretty good grades in school, I was pretty, had the right mindset, but everyone just seemed so much smarter than me when I went to dental school because, they maybe went to, they had the top education, they had help from their family, they had their parents were dentists, they had someone helping them the whole time. So I just felt like very isolated sometimes when we'd be in group discussions and, they'd know so much more than me about the dental industry. But I think now, thinking back on that mindset that I had about the imposter syndrome, I maybe needed to like branch out and try and network a little bit more. I think that's also one thing they don't teach you is networking is so key. And joining a community of dentists to learn from in terms of, from the business side or clinical side or just personal side, getting advice on how to navigate this very long career. So we, graduate when we're in our 20s and we're going to be doing this career for maybe 20, 30 plus years. So yeah, I think that's one part that's just going to help you in terms of your growth in dental school so much more. It's just trying to like speak to other people. But I didn't know that when I was in dental school. So I felt a little bit isolated, and that imposter syndrome, like you said, Nathan, comparing the comparison game, we're like hardwired to compare ourselves all the time to our peers. And when you're failing in SimLab, or you have to retake your class 2 restorations, or you failed for the first time one of your exams, it feels like the world is actually ending. But it's not, because you didn't get kicked out of dental school, you still became a doctor. And at the end of, a long career, you're not going to remember that you failed your class 2 restoration in your first year of dental school. Like, you're just not, there's going to be so many more ups and downs, and so many more highlights of your career that you'll remember than just these small things. So yeah, I would say just put it all in perspective as well.
Definitely, I completely agree with all that. And I think something, I don't know about you, but something I've always struggled with is with perfectionism. And I think dental school almost feeds into that more, especially the clinical exams where you need to have exactly point something, or if you're not good enough on this, then you fail. And it almost makes it worse. But I think as you start to graduate and you go from there, a lot of it is learning about being good enough and doing it so that it works, but not sort of beating yourself up on minor things, because you'll just end up not progressing, and you can't always do everything. You obviously will do it to the highest standard you can, but you can't necessarily always do everything absolutely perfect. And it doesn't mean that you're a failure if something doesn't work or something fails. And even a lot of people say if you don't have failures, it's because you've not done enough yet. And I think in dental school, you definitely just need to be mindful of that and try and not feed in too much into the perfectionism. But it's definitely difficult in that environment.
So
Perfection
wise.
is an unrealistic standard. I think something that someone taught me was like, don't chase perfection. I mean, we're all human. We're all gonna make mistakes. Chase to be consistently excellent in what you do. To do your best in what you do. You might not be perfect, and you might never be perfect, but each time you gotta put that excellence through, you review, you reflect on your work, you're gonna get closer and closer to being excellent. I love that.
No, absolutely. I think I'd be curious if you guys have a similar culture in dental school, but like in the US, dental, like, I don't get me wrong, I loved a lot of my dental faculty and whatnot, but you get a combination of people who just like want to give back and like teach the younger students. But then you also have this group of faculty who couldn't make it in private practice. And so they, there's this like it's not like bullying, but it's like where it's like they just, they definitely are not the best at giving criticism, and they kind of rip you to shreds on like whatever you were doing. And I think it's like learning to just accept that it's not like, hey, it's not something that you're doing. It's just that's how they are, and that some faculty are just better at giving constructive criticism than others. And it's just, it's like a lot of it seems like it's like, oh, well, this is how my faculty treated me, so I'm going to treat you like this.
Yeah, it's that
Definitely.
mindset that they haven't changed from their dental school days.
Yeah.
And I think, we have that kind of mindset where our generation are kind of, we don't take criticism as well, the snowball generation. But I think also times have changed, and, society is so much harder to grow up in because of social media. Everyone's comparing, their work all the time. And I think we naturally have quite high standards for ourselves, especially, dentistry forces us to be perfectionists, but perfection is not sustainable. You'll burn out if you think that you need to be perfect with every filling, every crown prep, every endo. You're going to make mistakes. And, as long as, especially when you're in practice, all the risks have been communicated, and the benefits of it and everything. That's just something that, it's inevitable. It's part of life. So yeah, I totally agree, Brandon. In dental school, we'd also had some tutors that were much better at being teachers and giving back to students than others, because, the clinicians, they would sometimes go to the dental school 2 days a week, and then they would work in practice for the other 2, 3 days. So they're not actually an educator first, they're a clinician first. So those high standards are naturally passed on to the students. But yeah, maybe a little bit more training in terms of giving feedback. I agree. But also it makes you a stronger student. Like you might then go and cry because, your tutor gave you some bad feedback, but you'll be better the next week. It's fine.
Exactly. And that's something that
Absolutely.
I definitely struggle with is receiving the feedback. I think it goes back to the perfectionism that you feel like you've failed because you've not done it exactly. But it definitely, as you progress throughout your career, learning how to take that feedback and use it to use the mistakes to become better. And it is trying to adopt like the growth mindset. So rather than being like, I didn't have a perfect prep, I'm rubbish, trying to sort of twist it and think, actually, if I did that on the next one, how much better will I be next time? And sort of using that to fuel your success. But it's definitely hard, especially with perfectionism. It's easy to beat yourself up, but even at dental school, try and sort of flip the perspective. And even going back to the books that are about like the chimp brain, I can't remember the name of it, but when
I've read that
your
book. It's
instant
really good.
reaction, yeah, your
Yeah.
instant sort of reaction is to almost react to it. And that's your chimp brain sort of trying to take a step back and think, no, actually, it doesn't mean that I'm not good enough to be a dentist, or it doesn't mean that I'm a failure. Actually, this is how I can become better. I think it's very difficult to kind of have that perspective when you're early on in your career, but a lot of people feel the same as well. So you're definitely not alone if you feel upset after someone's given you feedback, but it's definitely something I need to keep on working on as well.
Facts on facts. So yeah, anyone listening out here, if you feel any of this trauma, if this is hitting a pain point, you are not the only one going through this. We all have this shared trauma. It's
It's
crazy.
international. Yeah, I feel like it's so universal because we've all gone through dental school in such different ways at such different parts of our lives. So me and Megan, we probably went to university when we were 18, 19, whereas Brandon, for yourself, you were closer to maybe 22. Am I correct?
Yep.
A bit
Yeah.
older. Yeah.
Yeah.
So,
But
at the stages of our life were so different, but we all went through the same trauma. And even today, graduating, learning doesn't stop after dental school. And that's the whole point of this podcast, is just to share the insights of what we didn't get taught, which is no fault of the education system at all. It's hard to condense, the whole career of dentistry into 5 years, but there's just so much that, you learn afterwards that you have to just, learn from other people. And we're not gatekeeping here. So that's what the podcast is all
Yeah.
for. No
And it is really a
gatekeeping.
bit like when you're learning to drive, like to pass, they give you enough skills so that you can safely drive down the road. It's a bit like dental school. They give you the tools so you can do it, but the most learning is actually after. And you definitely learn the most then.
And eventually you reach the point where you just like you're driving and it just happens. It just happens.
So whereabouts, like, how did COVID have an impact on everyone? Because I know for myself, I was literally going into second year of dental school, and we were all lined up to start doing fillings and start seeing patients. And then all of a sudden we had 6 months at home, and it made a knock-on effect throughout the rest of dental school. Because when we went back, we were basically just doing hand scales, and all the fourth and fifth years were the priority, which of course makes sense because they needed enough to graduate. But then it meant our overall targets for graduating was lower than it would have been, say, a few years before. And I think that definitely gives like a confidence gap when you graduate, because you don't have the same, you still have the hand skills to pass, but not the same as it would have been before. And I think that is definitely difficult when you've sort of graduated and then when you end up on your own. How did everyone else sort of find COVID sort of impacted them?
yeah, I know for me, we were on spring break actually for our I was in Puerto Rico with like a group of with like a group of my friends from dental school, and they just like we got an email saying like, oh hey, school's gonna be canceled for a little while here. You guys aren't don't come back to campus and so we were all kind of like, whoa, this is awesome. Like I mean, relative, but it was just like everything became virtual for a while. Our school like went back pretty quickly compared to most. Like we were supposed to start. That was like the transition year where like you go start like it was at the end of the year and you start actually like seeing patients like when you transition to third year, and we started on time and we actually saw the normal amount of patients that you would normally see, and our clinic requirements actually increased. It was they had a planned increase and they just stuck with it. So we were pretty fortunate that our clinic experience did not change. But honestly, I don't know how much of a difference it really makes or not, because those, like, the amount of reps you get in dental school versus like when you're in private practice, residency is so different. It's such higher volume that, getting those extra 5 pounds, and like, does that really make that big a difference? Because a lot of the schools in the US, like some schools were closed for like up to a full year. Some people were graduating without being able to do like a root canal or doing extractions. Like, it was pretty crazy. And I know, like, for some of the students, like they kind of had to just like push them through and try to get them out, because it's just, there was no way to make up for the lost time.
Oh, fair enough. I'm a little bit like maybe just because I'm a baby to dentistry, but when COVID happened, I wasn't even in dentistry yet. So I
Wow.
was actually it was the year
Makes
before
us
I
feel
got
old.
yeah, it was
Yeah.
the
I'm the
year before I
same.
got
Yeah. I think I'm the
Yeah.
same. Yeah, I wasn't even in dental school yet in
yeah.
March of
Oh, wow.
that year.
It was the year before I got into dentistry, and low key COVID kind of helped me get into dentistry, kind of, because it was a period where it was like and COVID was a terrible time, so
Yes.
yeah,
Full
I'm not
serious.
discounting that, but
I'm sorry,
for me
Karen.
getting to dental school, it kind of helped because everything went online in the university in Australia, including all like the exams and stuff like that. And let's just say that the unis weren't really ready for what Google could do in terms of exams and everyone.
Yeah.
Maybe I should cut
Yeah.
that out.
So
But
I actually, because we did our first year exams were all in person, and then second year, because we're at home, they were all online. So they did flip the exams, so it was almost like open book. So you could use Google and you're allowed to do that, but they made the questions, they tried to make them harder. But something that made the difference was, after having all those online exams, our finals were in person. So after all that open book, a lot of people struggled with the actual final exam, because revision's so different, and you may not have taken in the topics the same when you are able to have open book. So that was definitely a challenge with finals.
yeah, actually, I had the same situation because, like you said, it became open book and they had the questions out. They did try to make it a little bit harder, but no one really sort of figured it out until like a year after that you have to make it really hard if you're doing open book. But then, yeah, the final few exams were all in person. And I remember that was like, I was like, I'm not ready for this. I'm like, but we made it. We made it.
Yeah, it's such a relief when you get your final results. I don't know how everyone here got theirs, but I was at Sheffield and we actually had to go in to get the results in an envelope, which the night before I literally had the worst sleep ever. It was just awful. And then you
That's
go in,
wild.
and then if you didn't pass, they would kind of look at you and be like, "Oh, do you want to open this next door?" And the whole time I was just imagining that they were going to be like, "Megan, come on, come next door." And it's not until it was torture, honestly. But
That's
I think it
horrible.
was more, I know, I think it's because they wanted, if someone didn't pass, that they had all the support there. They didn't want them to be on their own. But gosh, it was definitely stressful and such a relief but you're literally reading the thing like, where's the pass? Like, there's a massive letter from the dean, like, wait, where is the pass? But no, that was a bit traumatic. Yeah,
That is very
Yeah. I know
dramatic.
one
I
other
got mine
thing.
through email.
Yeah, email. I just got an email at home
Yeah.
one day and they were just
I'm
like, yeah,
jealous.
you passed. I was like, it's a little bit anticlimactic, but the envelope sounds way worse. I would not want to be,
Yeah,
if you were that person
it
going
was
to that
very
room,
stressful.
my heart, my
Yeah. Well,
heart goes out
especially
to you.
especially being around
Literally.
everybody, like everybody's going to see your reaction, like whether you made it or
Mm.
not, right? Like, so there's no, at
Exactly.
least, I don't know, I feel like seeing the email, right? I'm just like, okay, I did it or I didn't. And like, no one's going to see my reaction, like that's kind of wild there.
Yeah.
Yeah, no, it was definitely stressful, but it was such a relief when that feeling when you know that you've passed and it's all worth it.
Jeez. I'm gonna go to 10 sheet. Let's in terms of dental school, we've talked about like all these different experiences. What are some of the like funniest or like craziest experiences that you had in dental school? I think that we kind of just just like because dental school was highs
Ooh.
and lows.
Did you guys have, like, we called it stab lab, where like you learn how to do injections on each other essentially, like, but that's like, that is how we learn. And I remember
I'm so
she was
sorry.
at one of my good friends.
They called it Stab Lab.
Stab lab.
They called it Stab Lab?
Yes, yes.
That's terrifying.
Yes, it's fun. Kind of depends on who you get, right? And I actually got one of my good friends to be my partner, and I remember, like, she actually didn't even make it into my mouth. She jabbed my lip, and it was hilarious. It was like yeah, no, it was great. It was a great
A
first injection to
handshaking.
receive, you know.
I was
Go
gonna say I
ahead.
had to do it on my
Oh no, go
future
ahead.
husband.
Oh my
Oh
God, is
wow,
that
My
that's a lot of
SimLab?
husband,
pressure there too.
yeah. So he was behind me in the queue, so I had to stab him.
The
Nice.
needle was Cupid. The
The
needle was
needle
Mhm.
Cupid.
cube.
I've seen that on TikTok though. I've seen people be like, "Get ready for stab lab with me" and stuff. It's funny. Funny
Yep.
how
We
they
had
call
the
it that
same,
over
Great.
but
there.
I think I'm today years old when I realized people call it stab lab. Like we had that same like day where we have to inject each other, but I think that would make me so much more scared. My hand would actually be shaking. But that day we did the injections on each other for the first time. I kind of gave my best friend a bit of facial palsy when I was doing the ID block. So yeah,
Yeah.
it lasted a few
Love
hours.
that.
I felt so bad, but she was okay. It was not, no permanent damage was done, no paresthesia. But yeah, she was walking out with a little bit of a droopy face. I felt really bad. But now I can confidently say I've done a lot more ID blocks this year in my training year, and that they've all gone okay. I feel like that is one of the more difficult ones, though, is,
Yeah.
getting a good technique for that. But yeah, Nathan, who did you stab when
Absolutely.
you had your
I
clinics?
mean, I was gonna say, Reyna, at least you numbed the nerve. I stabbed my
At least
Yeah.
I got the
friend
nerve.
so many times, and I missed all of my blocks. I missed all of them. I was just like, and you would think that as a combat medic, because I actually, and now that I think about it, I got transfer. I did a lot of IV. So as a combat medic, so I should be
Wow.
used to needles. But yeah, I was stabbing him so many times, and he wasn't getting numb. So hey, you at least numb something.
A bit too close though, it's dangerously close, but it's okay. There's pros and cons.
And cons, I guess, on different sides of the needles, right?
Someone
Yeah.
in my year, they thought they were getting Vaseline for their lips, and it was actually topical anesthetic.
On their lip? They're putting it on their lips?
They thought it was Vaseline, yeah, because the tubes looked really similar.
Oh my gosh,
Oh
yeah, because it's
man.
clear as
It must have
well.
been a bit
Yeah,
of a fright, yeah.
too funny.
Yeah.
If you've done
Did
that, at
did
least
any of
know
you
that you're
guys?
not the only one.
I guess
Yeah.
all of the
One
students have
time,
Well,
that
oh,
to look
sorry.
forward to. All of the students have that to look forward to, stab lab.
Yeah. One time I was supposed to
great
be
times.
at Sheffield. There's like a big oral cancer kind of section where you go in and shadow some max fac surgeons. But as I went in, I misheard the person on reception for which room. So I ended up going into this surgery and I was kind of having a look like, this is a bit odd. And it turns out it was actually brain surgery and I'd misheard the number. And they were a bit like, and when I
Love
got
it.
in, they were a bit like, oh, so who are you? I was like, oh, I'm just a dental student. They were a bit like, I was like, no, I've been told I'm to be here. And they were like, that was not the best. But luckily, they did clock on quite quickly and took me to the right room.
Wow. Aren't patients awake for brain surgery? Because there's no nerves in the brain, right?
I think normally they are, but this one
They
was
were
like they were under
asleep,
general
yeah.
anesthetic.
I'm glad I'm a
Mm,
dentist, not a neurosurgeon. That's too much
yeah.
pressure.
Yeah, it would be a lot.
Yeah, Brendan, you're gonna say something before.
Oh yeah. Well, I was curious. Did any of you guys get dental work done by your friends or like other dental students? Because I remember, so when I was a hockey player, I broke like half my front tooth off, so I have a big filling there, and it broke like in the middle of my third year, and it was like everybody was like fighting, like, oh, let me do your filling, let me fix your front tooth, and I'm like, well, have you ever even done one before? And like most of them had it. I'm like, no chance you're touching me.
No way.
Like so everybody was just
Yeah.
like trying to compete for it, and then yeah, it's just it's funny how dental school is, right? Like you're seeing all these people and it's like you might be doing a procedure for the first time, and it's like, but like it's like, do you want to be exposed to that yourself?
Yo, that's so valid. And honestly, I love all my friends and I respect them. They're gonna be great dentists, but ain't none of you are gonna touch my teeth,
No.
bro.
Especially
not
your
Especially
not
dental
not in
front
that
school.
tooth.
moment, right?
Especially in dental
Yeah,
school. No
yeah,
way.
Especially when
not
that's such
not
an
not in that
aesthetic
moment.
thing. Cosmetic dentistry,
Yep,
no. You haven't even done your first class one filling. Like, don't come for my front
yep.
tooth. But no, I actually
But
had a lot of
grateful for
friends
the
who had
patients
their
that do. We're grateful to the patients that do. Bless their souls.
Absolutely, absolutely.
It's so good though to be in dental school surrounded by, so many experts because, we're sometimes the patient as well. Dentists aren't immune to dental problems. I think a lot of my friends had like their wisdom teeth out in dental school and things, and we'd see them in clinic next day and their face would be all swollen. We're like, what did you have done yesterday? And they're like, oh, this tutor just like took my wisdom teeth out. So
Yep.
there are advantages to dental school,
No
free
way.
treatment sometimes.
What would everyone's like, if you had to choose one piece of advice that you wish you knew at the time, what would it be when you're a dental student?
This is a
Ooh, I
good
wasn't.
one.
Have a little
This is a
think.
good one.
Say
Very good one.
I think dental school teaches you like you think going into dental school like before you start at least this was my perspective. It's like, oh, I'm gonna come out, I'm gonna have like pretty good idea of like what I'm doing, right? And you realize that like dental school teaches you the basics of how to do dentistry, but they don't necessarily like teach you how to be a dentist, right? They don't teach you how, because the dental part, right, becomes easy. Doing fillings, crowns, right? We can do that pretty quickly and it doesn't become that difficult. But talking with patients, right? Learning how to take this person who's super stressed out, they're in pain, and how to, reach them to make them understand what we need to do, and being able to manage your team, right? Like, I most of my problems on the day to day are more so managing the drama in the office, dealing with difficult patients, and I don't think like and our like universities, we don't get training on communication or like how to manage those things. You kind of just have to figure it out, or you take CE courses, right? We like like I've taken like C from like Bright Global, Dental Nachos, all sorts of different curriculums, and that's how we learn it. But it's like you would think they would, since that's probably the more important thing, you would think they would teach that to you in dental school too.
Definitely. And I think it's the perfect time to kind of work on those skills, because I don't know how it works in Australia and America, but for us, it was literally like you'd see like one patient or two patients all morning. So
Yep.
I think it's
Same.
definitely worth using the time that you have then to really kind of work on your spiel. So things that you say to every patient before things, or having analogies up your sleeve so that you can try and really take the time to focus on that kind of communication. But I think at the time you think the most important thing is the clinical skills. But as you graduate, you realize actually it is the soft skills, and it's definitely the best opportunity to practice them.
Yeah, definitely the soft skills, and I totally agree with that. You only sort of like start realizing how important communication is as a dentist once you sort of start your final year dental school and you start thinking, or maybe you even start working as a new grad. Because I'm not sure how it is in your countries here, but in dental school, our patients a lot of time they're getting sort of free treatment, if not subsidized, and there's really no specification or no education about like how do you communicate like costs, how do you communicate the fees, how do you like talk about that, and that's a big part of being a dentist realistically in Australia anyways. And yeah, that would probably be one of the things I would tell myself as well. Build your communication up, learn how to talk to they're not just a number or quota that you have to tick. They're real people. They have values, they have fears, they have goals, and really learning how to tap into that will probably be a great way to become a dentist. And I guess for me, another sort of when you asked that question, Megan, the first thing that came to my mind was don't let failure define you, let it refine you. And I guess we talked a lot about it already, but just for me, when I was going through, like you said, the perfectionism, the high standards that you set yourself, oftentimes I will internalize the mistakes that I made and I would tear myself down because of it. And because of that, I'll lose so much confidence. But reality is like when we're in dental school, it's like our first time doing all of this. Yet we put such a high pressure, a high standard on ourselves to do things perfectly the first time. And that's just not the right way. Treat it like every mistake is a lesson that you're going to keep growing through it. And that was probably the main thing that I had to adopt that helped me sort of go through and thrive. Not just survive dental school, but actually thrive. And
Love to hear that you were thriving in dental school, Nathan. We all made it out in the end. And I would say, very similar to yourself, like it's not a sprint, it's a marathon, dental school, and all the highs and lows are going to come with it. You're going to have amazing weeks where you felt like so fulfilled with your patients and your fillings went great and you're having a great time with your friends. There are other weeks where, things don't go to plan, but eventually, the curve will go up and down, but you'll be progressing and your progress, you won't see it, but over time the person you started at the beginning of dental school is going to be so different to the person you are at the end. And the other thing I'd say is just enjoy dental school, because I think we can all agree that we wish we were back in dental school, especially the social aspect, the lack of responsibility, minus, seeing, 1 or 2 patients a day compared to seeing maybe 20 plus patients, what some of us are seeing now. That kind of difference between being a student and being fully qualified is, you're just going to miss dental school so much. So do all the things now, because you may not have as much time when you're working, and just do all the side quests. I think, Nathan, you are like the CEO of like side quests. I think it's in your bio, like dentist on side.
I guess
So
so.
take a page from Nathan's book, is do all the side quests whilst you're in university, and try and do them after as well. But it's the period of your life where you're going to have the most time, the most fun. So don't wish it away, and don't think, I want to graduate. No, you don't. Like, enjoy being a student. Everything will come afterwards.
Exactly. And I
Absolutely.
think you, at the time, almost take it for granted, the environment that you're in. But when you look back, if you look at how many specialists and how many dentists with all these years of experience that are surrounding you all the time, whereas when you go into practice, you might be on your own or just with 1 or 2 dentists. I think definitely make the most of that opportunity, ask them lots of questions, learn from what they have, and then you can use that to learn the most and take every opportunity. So there might be certain rep positions, for example. I was one of the British Academy of Cosmetic Dentistry student reps. And if you have opportunities like that, definitely take as many as you can, because it means that you can do things to network. Like, I went along to the conference where you can meet dentists from all over the world. And it's so useful, even just meeting other students and building that network. And it really helps you in the future, having those contacts. And if you recognize people and go to certain things, so definitely take every opportunity and make the most of your time there.
I love all of the advice that we shared, and I really think that the listener right now who is listening in on their way to SimLab or on their way to work would definitely sort of relate to the points that, well, hopefully they relate to the points that we've shared here. And I just, want to restate that it's crazy just how, like, we're all from different areas, all from different parts of the world, yet all sharing the same story, all sharing the same lessons. And I guess that's a really good summary of how, like, what the Learning Edition is all about. We're here to show you that you're not alone, and you don't have to be feeling you don't have to feel stuck where you are by yourself. We're all on this journey to learn. We're all on this journey to grow, and we can all do it together. And it won't just be the 4 of us yapping every week. So this whole podcast, even though we could yap here for hours, we're gonna bring a bunch of people in every stage of the clinical journey. We're just gonna be the host, and we're gonna be talking to other new grads, other students with stories that are going to be so exciting to share. We're going to have mentors and even practice owners who've been exactly where you are, but they've actually come out on the other side. So it'll be amazing tips that they're going to share. And even people in, like, the tech spaces where we don't really see what's going on, but they're really just shaping the profession behind the scenes. Because, like I said, dentistry is not something you do alone, and we are here to walk you through it.
And next time we'll be moving on to your first job. So graduating dental school, onto the next step, starting your first job, and the challenges that we all face as sort of new graduates. So we really hope you've enjoyed today, and we'll hopefully see you next time.